Hi, I'm Alex, but many call me Dr. Mama Bird. I'm a wife, a mom, a chiropractor, and maternal health care advocate. After a traumatic birth experience that led to an unplanned C-section over 6 years ago, I found myself searching for answers on how to heal. Even though I was in the maternal health care space myself, I found it difficult to find the resources needed to truly recover and restore my body. After 2 years of research, I found myself pregnant with our second child and was able to have an amazing redemptive VBAC birth experience with my dream team. After that incredible experience, I felt God had placed on my heart a mission to help other mamas and families have a similar redemptive experience. And in time, with my husband's help, we developed the C-section restoration method. On this journey, we've met a ton of amazing healthcare providers that are often considered hidden gems in the Dallas area. Now, as a part of that mission, I'm here to connect you and other families with the incredible healthcare providers who are passionate about supporting you and helping you to achieve your family's health and wellness goals. I'm Dr. Alex Pankoch, and this is the Dr. Mama Bird Show. Alrighty, everyone, welcome back to the Dr. Mama Bird Show. This is Dr. Alex, and today I'm super excited to be interviewing a couple of friends and colleagues of mine that are gems in the DFW area that I think everybody needs to know about. We're going to start with John James from Kikino Institute and Megan Prichard, who is a midwife and a nurse. Both of them do what is called body work, but we're going to go into more detail on what that is. And they are passionate about helping mothers and babies to have a more peaceful entrance into that transition of parenthood, as well as throughout the entire lifespan. So without further ado, I'm going to introduce both of our guests. We've got John here.
Hi.
And Megan.
Hi.
We're so glad to have you. Yes.
Yeah, thank you.
Awesome. So before we jump in, I'd love to just hear a little more history about how you guys got started and what you do. So John, you're the owner of Kikino Massage Institute. It's a school, but it's also an incredible facility to receive care and services. Could you share this a little bit more about it?
Well, about 6.5 years ago, I bought Kikino. Kikino, however, has been there for almost 20 years. Kikino Institute of Healing is a massage school. We train 60 students a year, and we see about 800 patients a month.
Awesome.
So we're 14 in-house therapists, career therapists, and then again the school. And what's unique about Kikino is how those two things overlap, meaning that our students have a lot of access to our clinic, whether that's in shadowing, direct training, or even getting their own work done. But that's what's unique about Kikino. And we're in Plano. And then I've been practicing in Plano for this October's 33 years. So
that's awesome. Yeah. And Kikino's been around for a while. And you guys, we're going to talk a little bit more about maternal health care and pediatric care, but you serve the entire lifespan in a multitude of different things that people may want to seek health care with through body work and massage therapy. Is that correct?
Yes, there is. We have 3 different clinics. We have a corrective clinic where we do orthopedic type work. And then we have a family clinic, and a family clinic includes the C-section recovery center. And when we purchased Kikino, that's what we showed up with, was our private practice. And then on top of that, we had started this project called the C-section recovery center, where we were helping mothers recover from having a surgical birth.
Awesome.
And then we also have, we always have a third clinic that's kind of an incubator for new ideas.
Yeah.
And that clinic is now Finding Zero, which has to do with accelerated access to zero using body work.
Awesome.
So working with the autonomic nervous system, all of those things.
Awesome. So I'm just curious, because we're here, it's the Dr. Mama Bird Show. Can you share with us a little bit more about the C-section Recovery Center? And Megan, how did you get involved with all of it?
So as far as my story goes, I came as a referring provider to Kikino, bringing clients to John and other family clinic therapists to help them to recover if they had had a challenging birth or a surgical birth, or to help with latch issues as well. And then I did something which I didn't know was unusual at the time, but I came to all of those appointments with them. So I keep a smaller practice because I like that style of care. I like to have a lot of person-on-person connection. I feel like it makes a big difference. So I had seen John personally for one appointment, like 2 weeks prior. And during that appointment, he was telling me about all of the things that they do at Kikino. And then my very next birth, I had a baby very challenging birth. mommy was valiant, got the vaginal birth, but afterwards the baby could not latch at all. Yeah. So I messaged and they said, absolutely come in tomorrow. And were so welcoming and brought us in, and I went with them, and we left with a baby and mommy that were more bonded together. Yeah. That they both felt a little bit calmer. Mommy felt healed in a lot of ways that I didn't expect that early postpartum, and the baby could latch without a nipple shield, without a revision. So I was absolutely blown away, and then just couldn't look away. So.
That's beautiful. Mm-hmm. There's so many moms who want to have that experience of breastfeeding, and there can be a lot of challenges. It's like the most unnatural, natural thing you'll ever do.
It is.
But at the same time, the birth really does impact how a mom and a baby may be able to latch. And so having some support with a team that is knowledgeable on so many different aspects of that piece is so crucial. I'm curious, John, so we talked about breastfeeding. We've got the C-Section Recovery Center, but you also work with newborns and infants and that first four months really of life. How did that all come together?
I'm not sure which part you're talking about, but let's start with the C-Section Recovery Center. Yeah. We had noticed many years ago that women who had a surgical birth, or maybe anything with a phalansteal incision, meaning like hysterectomies as well, that we would see this significant increased symptom of TMJ and mid-back pain and plantar fasciitis. So what we were seeing is when the pelvic floor was interrupted surgically, that it would produce this compromise that would show up in those areas. And so we started exploring what would it look like to resolve this by resolving the tension that had been surgically created in the lower pelvis. So that was kind of the first big aha moment. After that, I guess the next big thing, because we were working with adhesion and moving of diaphragms and all of those things, what happened next is we realized that the mother had this sense of incompletion because she hadn't birthed vaginally. That Dr. Upledger calls it retained biological frustration is left behind when the vaginal birth hasn't happened. Even though a C-section is an absolute miracle at times, it still leaves something behind that's incomplete. And so we started exploring the possibility of could we produce the sense of completion biologically using our hands. And so that's, long story short, that had us still focusing on mom, which is something that's unique to our approach, is that our approach is always focused on mother first. Almost like we're going to optimize her, create her the best mom we can create so that the baby has easier work to do. And then after that, we started exploring what would it take to complete the biological process, and that would require us to treat the baby as well. So we started exploring ways to get the baby to push like they're birthing. And so that involved us putting baby in utero positions, super light touch, but accessing those positions and then allowing the baby to kind of show us what they missed maybe. One of the things we'll notice is when the baby's under some light compression, the baby will start moving in ways that demonstrate where their birth was interrupted, or where they had a hard time, or if they had a cord around their neck. You'll always find a moment in that treatment where that shows up. And you get a chance to heal that.
That's beautiful. And I've experienced this firsthand with my little one. Most of y'all know my story at a C-section, a very traumatic C-section with my first. And having worked with John a little bit later, not as a newborn, didn't really know at the time the amazing things that you guys did, but just seeing the change, the frustration builds up. I've noticed with my kiddo, builds up over time. And sometimes it's like, oh, it's just their personality, or it's just this, or it's just that. But you just see this like overwhelming frustration, or at least I did with my kiddo, that after starting this work at a much later age, I think it was like 5, and getting work done together, this just peace come over him of him physically not seeming as frustrated through most of the things that he does. His personality, he's not as easily frustrated. Now he still has his personality, but he's a lot more peaceful in general after this. So for moms who have had a C-section, whether it's been, a couple of months or a couple of years or even longer, if you're noticing some frustration, that is something that could still be worked on,
Absolutely.
correct?
Yes, absolutely.
Yeah.
And we'll still focus on the mother. If the mother were to say that you can only treat one of us, we would just treat her.
Yeah.
And we would see a profound change.
Yes.
So we treat the mother to as much completion as possible.
Yeah.
So, and that's one of the things that was so helpful when Megan showed up. First of all, she showed up and started just sitting in. I'd never seen anyone do that. They could manage the schedule to get there. Yeah. As busy as our midwifery practice was, that she could get there and be there with all of these patients of hers. And so we pretty quickly went, we should just train you.
Yeah.
I don't know what visit that was.
The fourth one.
Yeah, the fourth one.
Yeah.
So the fourth visit, I'm like, if you're going to keep showing up like this, we're going to train you.
Yeah.
And so we started training her, but what we learned from her is even more, because she's been in 200 or 300 births. So that's not something I could claim, and so I didn't have that expertise, and so it was really helpful to have her in those appointments. It makes a very big difference.
Thank you.
Yeah, that's awesome. I'm curious, midwife. Megan, why did you decide to become a midwife?
So I was a nurse first.
Yeah.
And as a registered nurse working in the field, I've always been a little more mentally on the holistic health side.
Yeah.
But I was able to see like the really significant gaps that certain parts of Western medicine had, especially around maternal care. So I always knew that I wanted to go into labor and delivery, pediatrics. Like I always knew mom and baby care was my spot.
Yeah.
So then I got pregnant with my son, who is 11 and a half now, and met this random lady that's now one of my lifetime friends at a chiropractor's office. First chiropractic visit I'd ever had in my life. And sat down and met this woman and her newborn. And I'm, of course, first time mom. So I'm like overwhelmingly excited. And I'm like, you had your baby. And then I'm just wanting to talk with her. Like, please, talk to me. And she did. And she's like, who's your OB? Do you like them? And I didn't realize she also drilled me and changed the trajectory of my life.
Yeah.
In that one particular moment. And she's like, okay, so you need to meet with a midwife. Here's who you should talk to. And, and I was like, I've never heard of this. What's a midwife? I'd never heard of it before. So I went and met with the midwife that I used for both of my children and completely fell in love with it. And then after I had my child, I stayed at home with him for 2.5 years. And then realized, okay, I think I'm ready to go back into the workforce, but I don't know that I want to be a nurse.
Yeah.
So I had reached out with her, to see if she needed help, as a birth assistant or whatnot. And I had not been there long, similar story. About 2 weeks in, she's like, what's your 10-year plan?
Yeah.
And I was like, I don't have one.
Yeah.
She's like, well, should I offer one to you? So, and I had considered it. I was like, wow, what would it be like to be a midwife? That sounds like that would be challenging, but hard and beautiful. And I wonder if I could do that. And I learned I could. So, and then, I caught my first baby in 2015. So my son was born in 2012. So that was kind of stayed at home with him for that period of time and then just kind of seamlessly shifted right in. And
that's beautiful.
Thank you.
In chiropractic, we have this saying is that you don't find chiropractic finds you. But what I'm noticing with the more interviews we do, more people who are super passionate about what they do have a very similar story where they just kind of bump into it. And they're like, wow, this radically changed my life. And now I want to impact more lives this way. John, I'd love to hear about your story. How'd you get into massage therapy and where you're at now?
I had been working. My dad liked to build things. And so I kind of ended up in the construction industry as a kid. Working as a young kid. Yeah. I wouldn't say I ever loved that, but I met this physical therapist that lived in Allen at the time and was opening a facility in Plano, and he asked me if I'd come work for him. And it was the first job. I made $1.75 an hour, I remember, because that's how old I am. But I made $1.75 an hour, so it was horrible money, but I really loved that job. I realized that I was gifted in working with people. I was definitely gifted in working with my hands. So I spent a few years there and then went off to college. Still wasn't really clear. And then I noticed that they just started licensing massage therapists in the state of Texas. And so that's where the idea came from. So I called that same physical therapist and talked to him, and he said he would hire me. And so I went to massage school in Dallas and then came back, and in January of 92, started working for him and spent 6 years in sports rehab. But that's how I got into it. But I was called, just like you guys were mentioning, that that's something at Kikino we look for when we're talking to potential students. We'd prefer to have a student that had some sort of calling to the profession, and I certainly had that. When I was young, my sister was very ill, and so I realized I first developed some facility around being a caregiver at that point. I was only 6, but I can remember that well, and she was 9. So I think that's where it started. I think once I kind of got going, I started finding all sorts of ways that my life had contributed to the skill that I seem to have in working with people. So
that's awesome. And they say God equips the called. He doesn't always give, the called. The equipped aren't always the ones that you think are the ones who are going to build all the things. And so what you guys have done is stepped into that calling so nicely, and then all of the pieces just beautifully fall into place. It sounds like
something like when I got called to start working with babies, I was like, no, please no. I'd always said I didn't want to work with babies. And I think the reason I didn't want to is it was really difficult. Yeah. Like, I can see why there's not a lot of people doing really good baby care, because it's a very difficult skill. I think that's one of the things that also I noticed about Megan is because she had been in a lot of births, it was hard to rattle her. Yeah. And so that's probably why we also do guided frenectomies together. And so I think that's also why that came so easy to hers, because she's like, this is nothing.
Yeah.
I resuscitated a baby this weekend, so no big deal, right?
Yeah.
So, yeah. But I think sometimes after I got in the profession, I started to see all the ways that my life had contributed to this gift. And like you said, God sometimes points us in directions where, like, it might be more difficult than we had planned on. It's not always something that's easy.
Yeah. I have a very similar story as well. Sports chiropractic was my thing. I really didn't want to have anything to do with moms and women.
And look at this.
And so now I'm Dr. Mama Bird. Yeah, it's very, that birth experience and in and of itself and a few other things really impacted that trajectory. But I was like all for, I'm going to work in the CrossFit gym. And I had always personal trained men. I never personal trained women. And I was like, this is completely opposite of the direction. But it's really fun when you finally show up in the space that was created for you before you realized that it was there. Awesome. So I'd love to hear, you mentioned a little bit about frenectomies. We talked about that on another episode with Dr. Tony Ingram. So with the C-Section Recovery Center, it's not just working with women and babies who have born via C-section or surgical birth, but moms can have all kinds of birth experiences, and those can oftentimes lead to, as you mentioned, sometimes struggle with latching. Even if it was an incredible birth experience, sometimes babies come out and we need to troubleshoot. We need some support. Could you share with us a little bit more about the work that you do on newborns when it comes to tethered oral tissues or tongue ties, and how it all plays together with potentially working with a dentist and other providers?
Absolutely. Yeah. So like you said, even if it's the most graceful birth on the planet, you still physiologically have what you came in with. Yeah. So we see a frequent case of tethered oral tissues. So talking about the frenectomy, that is the physiological release of those tissues to better aid the body's fluidity and motion, as well as the fascial system, the muscular system, so that the baby can latch more appropriately and with greater ease and comfort for the mom and baby both. I mean, because we think about mom's discomfort, but babies that don't latch properly are in a lot of discomfort. Yeah. So they're sucking in compensation with the wrong parts of their body. You can watch the little ones that are, they're sucking a little bit over here, and then you can see how they're pulling over here. And it's not ideal, and it's not the ease and grace that we all want working into our postpartum period. So in our bonding with our baby. So just like we were mentioning earlier, we treat mom first, universally across the table. So the majority of the appointment is with mom, and we're talking through, let's connect. How was your birth? How do you feel like that went? How are you feeling in your body, your mind, your spirit? How can we support you? Also, we're bringing in I'm endlessly fascinated by what naturally comes into appointments, whether it's the mother's own childhood or a car accident that she had when she was 17. And how all of these things interwovenly play in. We as humans are incredibly complex creatures. Yeah. Our lives are long and they are complicated. So we are working to unweave some of that, to work with the mom and the baby as the dyad, so that they can heal not only from this birth, but potentially prior births that the mom has had, and working together. And then the tethered oral tissues just add a whole nother layer into that. So we're already so complicated over here. And then also our mouths don't work quite right. So a lot of times we are able to work with moms and babies and get them latching without the guided frenectomy, which is always, we are not trying to break down the door and do a frenectomy on every baby. That's not by any means. So, but we hold a lot of pride and honor that we get to be there to guide the procedure when it's actually necessary. We get to work so frequently with the wonderful Dr. Tony Ingram, who we absolutely adore and treasure so much. And we have worked with mom and baby several times. Typically prior to the procedure, we want to clear the body to make sure it's as open and as receptive as possible to the procedure, because a frenectomy, while being a very simple thing, it can really complicate a mom-baby relationship. It's not something to go into lightly. It's not something to go into without support. And it's something that's being done very frequently right now without guidance, help, and support. So we're very much team don't do it that way.
Yeah.
And so we're bringing mom and baby in. We're making sure they're actually fully educated. What does this mean? What is a feeding strike? How do we avoid these things? And also, let's optimize your body. Let's optimize your baby's body. And then not only that, we want to follow you to the procedure. You're actually quite stuck with us. And then we go and do a double guided procedure. So mom and dad have trusted us with the baby. We take the baby into the procedure room with Dr. Ingram and the rest of her team. And I'm sitting on the dental chair, helping to guide and keep the baby's fascial system, their body open, and to get the maximum release of these tethered oral tissues so that it can actually improve the looseness and functionality of the entirety of the baby's body. So, and then John is guiding up at the head. So there's a lot of people crammed into a teeny tiny space.
I've been there.
Yeah. We did it accidentally as a double guide once. We didn't have a dental assistant or a head holder that day. And John's like, I can be a head holder. I'm like, you're the most overqualified head holder I've probably ever seen. But then we were both like, oh, wait.
It was a totally different release.
It was completely different. So now we both go. We thought we were just training me to go. But now we both go. And it's gotten even better, which is just amazing. So like we're so honored to be doing it. And then we do post-operative care as well. So they have our personal cell phones. I mean, we were talking to last week's all through the weekend, troubleshooting, let's talk
celebrating
about
sometimes.
Most of the time celebrating. And when it's that graceful, that's all we're doing. We're like, this is amazing. Like, tell us when you have questions. We'll see you on Monday for your post-op. And then when it's not graceful, like this mom has never successfully breastfed before, but she is now, so we're still celebrating. Yeah. But she's like, oh, but I have a clogged duct. Okay, well, let's troubleshoot this. And if you massage with, let's talk about lymphatics. And so there's this continual support and education process, which is my very favorite. So
I love that you bring all of that together. I think in medicine, traditional conventional medicine in our country, a lot of times the follow-up is not quite there, or like the connection with the provider is not quite there. And I can't blame providers for that, because unfortunately there's just too many people seeing one person all of the time. And so I know a lot of doctors who feel very overwhelmed with their caseload, but by being intentional with what you can and cannot do allows for you to provide this amazing higher level of expertise, but also just continuous care and connection with a cell phone number, which is something we also do in our practice as well, because we have seen a lot of the cases after frenectomy that was kind of just like quick in and out, or after a C-section or something like that, or a birth that mom has no resources after this life-changing experience, especially being a lot of people who are new to Dallas. They don't have families here. They don't have people to connect with, which is why we have this show. So that way you can find some providers, some amazing providers to connect with if you find yourself in that position where you're like, I don't know what to do. I don't have my OB's number. I don't know to text if this is not normal or not during my pregnancy. I don't know who to reach out to. So I'm going to go to Google and freak myself out. Let's not do that. So we're very blessed to have providers like you in this community. And well, there's quite a few providers in this community that are so passionate about what they do that, when working with a new family, John, also, we haven't talked about it, but you work with dads as well. You're really about helping these people step into a completely new aspect of life with peace and ease, and learning how to be a parent, learning how to be a person in a completely different aspect of life. And doing that with support with a team, which normally in most parts of the world, you would have a tribe or a community that can come in and say, okay, hey, we're going to help you through this like this. You don't have to be on an island. You don't have to be alone. And bringing that here to this huge metropolis of a city is just something amazing that you guys offer. And I love that you talked about that. And you talked about that there's not a one size fit all. Like, when it comes to frenectomy, when it comes to post-surgical work after birth, or really just in general, there's no one size fit all, and really taking the time to consider what other pieces are at play here. Did this person have, thinking of myself, like multiple sports injuries before the surgery that are playing into this? Or has this person had other kinds of traumas that are going to potentially affect how they're going to experience things in the future? Is also crucial to really consider as we make choices with our health and then intentionally recover. So I love everything that you guys are doing. With the C-section recovery center, if a mom is saying, okay, I've had a C-section, I've been frustrated, or I didn't receive any post-op instructions, which is a common case. I remember I walked out of the hospital, like, here's a sheet of paper, don't die, we'll see you in 6 weeks. You go to that 6-week appointment, they're like, you're alive, you made it, congrats. And,
Would you like some birth control?
Yeah, it's a very interesting. It's very interesting because any other surgery in the world or in healthcare, there is some type of rehab that is prescribed. There is some type of follow-up that is done. When I had my first C-section, I can remember thinking, this is it? Like, I know 30 protocols for a basic ankle sprain. I just had major abdominal surgery, went through 7 layers of tissue, depending on which ones you count. Potentially more than that, but went through several layers of tissue, and I'm just supposed to like walk it off and now be a mom and hold a baby. And for any mom who's felt that way and felt like, I don't know why this is so hard, it's hard because you don't have support, and it's okay to get support. And there are people who want to support you, myself included, here in the DFW area. So with that, I would love to close and just ask you guys, what is the best way for somebody to reach out and receive more information or book an appointment with you guys?
Well, if they contact our office at kikino.com, it's probably a good place to start. Yeah. The front office will establish a line of communication with the appropriate therapist and the patient if there's a long wait time. And the reason we do that is because if it's for Megan and I, we'll find a way or a time to see them much earlier. Like today, we're seeing a mom of C-section twins. Yeah. That we're just squeezing in. We're actually putting her in a training appointment. We'll figure it out. Yeah. But the best place to start is there. We usually talk to people before we ever have them come in. Yeah. So on the way home, I'll call them, or they'll talk to Megan or someone else in the practice. with the idea is just making sure it's a good fit, making sure they understand what they're showing up for.
Yeah.
Making sure they know and accept that they're going to be treated first, that the mom is going to be treated first. So, yeah, I think that's basically it.
Awesome. Well, it's been a pleasure to have you guys on. I've loved working with you, and we'll continue to work with you guys. And
we appreciate you having us. Thank you.
yes, thank you for being on. For everybody watching, I hope you guys learned something amazing today. There's just, if anything, there's so many providers in this area that really want to support the transition into motherhood. And if you are looking, come here. Also reach out. We all know a lot of different people. If ever something's not a good fit, we're all very good about making sure we find you the right fit. So that's all we have today for the Dr. Mama Bird Show. And I hope you guys have a blessed day.